Hello and welcome. Today we're diving into a rare and complex condition called Michel Aplasia, also known as complete labyrinthine aplasia. This is a congenital inner ear malformation that has profound implications for hearing and balance. Join us as we explore its causes, effects, diagnosis, and management. The exact cause of Michel Aplasia remains largely unknown, and in most cases, it appears to be sporadic, meaning it occurs randomly without a clear inheritance pattern. However, genetic factors are suspected to play a role. Some research suggests that mutations in genes crucial for inner ear development, such as those involved in the formation of the otic vesicle, may be responsible. Exposure to certain teratogens, substances that can cause birth defects, during early pregnancy might also be a contributing factor, although concrete evidence linking specific teratogens to Michel Aplasia is limited. Michel Aplasia represents a complete failure of the inner ear to develop properly during fetal development. The labyrinth, which houses the cochlea, responsible for hearing, and the vestibular system, responsible for balance, is entirely absent. This absence disrupts the normal transmission of sound and the processing of spatial orientation information. Without a functional cochlea, sound vibrations cannot be converted into electrical signals that the brain can interpret as hearing. Similarly, without a functioning vestibular system, the brain receives no input regarding head position and movement, leading to severe balance impairments. Michel Aplasia is an extremely rare condition. Due to its rarity, precise epidemiological data is limited. Estimates suggest it affects a tiny fraction of births, making it one of the least common inner ear malformations. Because many cases may go undiagnosed or be misdiagnosed as other hearing or balance disorders, the true prevalence may be underestimated. The primary and most significant symptom of Michel Aplasia is profound sensorineural hearing loss, meaning that the affected individual has no usable hearing from birth. In addition to deafness, individuals experience severe vestibular dysfunction. This lack of vestibular function results in significant balance problems, often causing delayed motor development, difficulty walking, and a general lack of spatial awareness. Children with Michel Aplasia may also experience nystagmus, involuntary rhythmic eye movements, as the brain attempts to compensate for the missing vestibular input. Diagnosis of Michel Aplasia typically involves a combination of audiological and radiological assessments. Otoacoustic emissions, EOA testing, and auditory brainstem response ABR testing will show no response, indicating a lack of inner ear function. The definitive diagnosis is made through high-resolution computed tomography, a CT, or magnetic resonance imaging (MRI) scans of the temporal bone. These imaging techniques will reveal the complete absence of the inner ear structures, confirming the diagnosis of Michel Aplasia. Michel Aplasia, by definition, is a complete absence of the inner ear. Therefore, subtypes or classifications are not generally applicable. The defining characteristic is the complete failure of the inner ear labyrinth to develop. Currently, there is no cure for Michel Aplasia. Treatment focuses on managing the symptoms and maximizing the individual's ability to communicate and navigate their environment. Cochlear implantation, the standard treatment for severe hearing loss, is not effective in cases of Michel Aplasia because there is no cochlea to stimulate. Auditory brainstem implants, or ABIAs, offer a potential avenue for some hearing sensation. These devices bypass the inner ear and directly stimulate the auditory pathways in the brainstem. Vestibular rehabilitation therapy can help individuals learn strategies to compensate for their balance deficits. Early intervention, including sign language instruction and other forms of communication support, is crucial for language development and social-emotional well-being. Given that Michel Aplasia is a congenital malformation, there are currently no known preventative measures. Genetic counseling may be considered for families with a history of congenital hearing loss, although the sporadic nature of most cases limits the effectiveness of this approach. Avoiding known teratogens during pregnancy is generally recommended, but its specific impact on preventing Michel Aplasia is uncertain. The prognosis for individuals with Michel Aplasia is challenging. The lack of hearing and significant balance impairments present substantial developmental hurdles. However, with early and comprehensive intervention, individuals can achieve meaningful gains in communication, mobility, and independence. The use of auditory brainstem implants holds promise for some auditory perception, but the outcomes vary widely. Research is ongoing to explore new strategies for restoring hearing and balance function, including gene therapy and stem cell-based therapies. These areas offer hope for future advancements in the treatment of this rare and complex condition. One area of research is focused on improving the efficacy of auditory brainstem implants, exploring ways to enhance signal processing and stimulation techniques to provide more meaningful auditory input. Further studies are also investigating the potential for combining ABI technology with vestibular implants to address both hearing and balance deficits simultaneously.